is Dr. Jidong, who's a lecturer at the Department of Psychology at the Nottingham Trent University. He's working over the time, I've heard his name many times, in terms of his work, especially around culturally adapted psychological interventions for African and Caribbean population. So over to you.
Thank you, Rochelle. Right, thank you. So, yeah, my name is Dr. Dung Jidong. I'm a lecturer at Nottingham Trent University, and I have particular interest in culture and mental health. I've done some previous work looking at the impact of cultural beliefs on mental health, especially in the Nigerian community. But today I will be giving you an overview of the kind of work that is ongoing, which is on maternal mental health. See on the previous slide, please. So yes, we are currently doing some kind of exploratory study, looking at the possibility of triangulating our knowledge and looking at maternal mental health in Nigeria, in Kenya, and also in the UK. And as we go through these few minutes of presentation, I also have my colleagues who are joining us here from Nigeria to tell us more on some of the studies we've completed. Next slide, please. Thank you. Right, so I've been in and out of today's conference for numerous other academic engagement, so I probably would have missed quite a significant part of other speakers' presentations, but I did remember Professor Imran Chowdhury did mention earlier that there are quite a lot of interventions that are already here in the West, and we also know that some of those interventions for mental health might not necessarily be culturally appropriate for other low and middle income countries like Nigeria or Kenya, etc. And even within the UK, for example, there are other ethnic minority groups who literature have shown that the current mainstream intervention is not culturally appropriate. So this kind of project, I've been thinking of the possibility of exploring all those research and opportunities, and also to kind of offer some kind of evidence-based intervention that are low cost and are effective and also culturally appropriate. So the study we're doing so far has been split into about 3 phases. So first one, we've been doing systematic literature reviews and focus group. And the current state now, which is where we are at the moment, we are doing both feasibilities and pilot study to test run how learning through play and culturally adapted cognitive behavior therapy would be used as the basis for offering support and treatment for depressed women or women who are distressed. And the phase 3, or the phase after now, would be intervention, where we're looking out for large randomized controlled trial testing and checking the efficiency and effectiveness of LTP, culturally adapted CBT. Next slide, please. So this is the work we've been doing so far. We did one of the systematic review, which look at intervention research or psychological intervention for maternal depression among women of African and Caribbean population. In this systematic review, it was quite alarming that in the UK, we couldn't get to see a significant number of intervention research that are specifically tailored for African and Caribbean population. But of course, in America, there are a few of those who have been conducted, but thankfully, we've submitted this work, is currently under peer review. One other study which we did, systematic review, is looking at maternal mental health in Nigeria. And this also is under peer review. We also did a focus group, which also constitute part of our phase 1 stage of our study. We look at the lived experiences of mothers in just Nigeria, And in the next few minutes, my colleague will be telling us more about that study. We have also conducted another focus group looking at women of African and Caribbean origin here in the UK about their own lived experiences as mothers who have young children, what kind of support system they've been getting, and perhaps what do they think might be more useful and which is also culturally appropriate or significant to them. Our phase 2 studies currently, we have conducted and completed a feasibility study which looked at the treatment of maternal depression in low-income women of Kilifi, Kenya, and that is also on under review with the Journal of the Royal Society of Medicine. And currently we've secured another ethics to conduct a feasibility study in Nigeria, which would then give us a more grounded knowledge on how LTP can be useful for treating depression and also helping in improving child well-being in just Nigeria. Next slide, please. Next slide, please. Right, so I will invite my colleagues from Nigeria, who I believe they're joining us, to Christopher and Shedrack to kindly tell us a little bit more on the focus group we conducted in just Nigeria.
All right, thank you very much, Dr. Dung. My name is Francis Christopher. I study psychology, University of Jos, and also I'm a clinical research assistant. I'm here to shed more light on the objective of this research. There is an increasing mental health disease burden in mothers with infants and young children, especially in low and middle income countries such as Nigeria. Children of distressed mothers suffer early exposure, maternal distress, which contributes to the risks of physical and mental health problems in their childhood and beyond. This study for explore mental health lived experience of mothers in just Nigeria. Let me link you to my colleague, Mr. Shedrack, to tell us more on the method we adopted in conducting this research. Shedrack?
Yep. Thanks, Christopher. My name is Shedrack Beatrice Malcolm, and I'm studying psychology at the University of Federal University of Ekiti in the state. Not to waste much of the time, I would like to go quickly and talk about the method we use in this research. Yeah. So a total number of 40 mothers participated with 8 to 11 participants in one of the 4 focus group discussion, and purposive and snowball sampling techniques were adopted. Yeah. So participants were between the ages of 18 and 43 years. They're self-identified as mothers, with each having a child between the ages of 3 and 48 months. Then each focus group lasted approximately 60 minutes and was audio recorded. And interviews were transcribed and verbatim and analyzed using interpretative and phenomenological analysis. I will call on my colleague, Christopher, to talk on the result. So, Christopher, over to you, please.
Yeah, thank you, Shedrack. Result session. We have 3 overarching themes emerged from the data set, such as experience of persistent psychological distress from the time of labor to birth, and cultural practices that influence feelings, and the anxiety due to limited knowledge about children, access to support and healthy food. So conclusion, we concluded that in Nigeria, maternal mental health is under research, and depressed mothers have limited knowledge about evidence-based early child development. We also recommend that there is need to develop and test culturally appropriate parenting, parenting intervention in just Nigeria that could be beneficial to mothers and maybe help with improving child well-being and development. Dr. Ezekiel, permit me to hand over to him to take it from there. Thank you.
Thank you, Christopher, I appreciate it. So we conducted that focus group initially to engage with those mothers in the designated communities to also get to hear what are some of their plight and some of their experiences. And one of the things which was actually quite touching then was how some of the mothers were so excited just noting the fact that other people or researchers have the keen interest to just talk to them or give them the opportunity to air out their views in terms of their lived experiences and the maternal challenges they've been going through following their childbirth. And this obviously gave us a kind of a strong recommendation for test running the LTP plus intervention, which would then harmonize or give mothers the requisite parenting skills on how to interact with their children and also monitor how their children grow. And of course, literature has already shown that parenting of children at their very formidable age is significant and have substantial impact in their life, even when they grow to adult age and so on and so forth. So LTP covers significant aspect of the intervention, which covers within the sense of self, physical relationship, and understanding of the world, as well as communication. And the CBT component, of course, we know this help to flash lights or potential significance to core beliefs and automatic thoughts that might be associated to the pressure that those women experience in their daily role as mothers, especially in a very low income settings, and issues of religiosity and spirituality. Nigeria as a country, it's a context that gives so much significance to issues of religiosity and spirituality. And of course, the culturally adapted CBT will also help us to be culturally sensitive and assertive and building confidence on those mothers and breaking all barriers of social isolation and encouraging social network that can be elevating to mothers who are distressed as a result of parenting and so on and so forth. So I think we have also been, thank you, we have also been privileged to have quite a good collection of experts in our team. We have Professor Nusrat, who is a psychiatrist and has been always available and participating actively in the different aspects of the research. And we have Professor Dagona and Professor Carrick and Dr. Pajok, who are all clinical psychologists and based at the University of Jos. And we have Francis Christopher and Maisha and Shedrack, who are research assistants who have also been contributing immensely in the different aspects of the research. And then we have Dr. Gumba, who is a health economist, and which is a significant contribution in the project team and also going forward. And we have Dr. Brown, Abraham Brown, who is a health statistician and also playing a key role there. We have Dr. Roche, who is a practitioner, clinical psychology, and a GP here in the UK, and has been working or have several couple of years of experience and working with people of African and Caribbean origin. And we have Dr. Tarela Ike, who is a maternal health advocate and also a lawyer and a lecturer here in the UK. So, and myself in the middle as a clinical psychology and a lecturer at Nottingham Trent University. So this is just kind of give you a picture of our team and a good combination of people with different professional and expertise that come together to a common goal. Next slide, please. Right, so we have a few acknowledgements here. The phase one of our studies, which is mostly around systematic literature reviews and focus group, we have been getting some small pockets of money from the NTU QR fund, which has been helping with the assistance, research assistance time. And for the feasibility study that was conducted in Kenya, we had support and funding from the Canadian International Development Agency and the Center for Africa for Learning and Living. And also want to use this opportunity to extend our gratitude to Professor Nusrat Hussain, who has been a great mentor. He has been tireless and ensuring that we're always on track. And despite his busy schedule, he has always been available. So this acknowledgement also goes to Professor Nusrat Hussain. I want to say thank you so much for all your support and contribution. Thank you.